So when I was a little girl, I just have this vivid memory of watching Magic Johnson talk about being HIV positive and how just full of awe and admiration I was at his courage, at his commitment to not being stigmatized for his HIV status. And it had such a profound effect on me as a kid. And so kind of I'd always been interested in health and kind of in what I would now, call public health, but wouldn't have known kind of that term back in probably late elementary school. And yet, kind of he and his story and his courage really got me interested in how we treat and how we talk about patients and disease. And so, kind of fast forward, kind of maintain my interest, especially in kind of HIV/AIDS throughout high school and college. Wrote my kind of first master's thesis on the Global Fund to fight AIDS, tuberculosis, and malaria, which at the time was a relatively new institution to try to help the world raise more money to deploy in more places, to be able to help prevent more new infections and help treat people who are living with HIV and AIDS. And kind of that still remained the topic of my doctoral work years later when I went back to school. And now I've taught at the Mailman School of Public Health for about a decade, through the Clinton Foundation, the Clinton Health Access Initiative. We do a lot of work all over the world to try to help people be able to access kind of what we believe everyone should have access to help protect them from getting sick or to help treat them if they are sick. And while that work started in HIV, we now do lots of work in malaria and tuberculosis and maternal and newborn health and so many other areas.